Okay, continuing with antibiotics, let's talk about the cephalosporins. Cephalosporins are medications such as Ceclor, Ancef, Keflex, Rocephin, or cefotaxime. These medications inhibit synthesis of the bacterial cell wall, so they don't allow the bacteria to build cell walls. They are used for problems such as tonsillitis, otitis media. They are used for perioperative prophylaxis, and they're used for meningitis. Let's take a look at some of the side effects you'll see with the cephalosporins. One of the serious side effects is bone marrow depression. And again, you want to make sure and monitor the patient's lab values to make sure they're not becoming anemic or thrombocytopenic or any of the problems with bone marrow. They also can cause superinfection, and we talked about that before, and sometimes they can cause a rash. The nursing considerations for the cephalosporins is these medications should be taken with food. That helps decrease the GI upset the patient may experience. There is a cross allergy, and this is very important for you to know. These medications are similar to penicillin. So a certain percentage of the patient, and I believe it's about 10%, have a cross allergy with the cephalosporins and penicillin. So if you know a patient is allergic to penicillin, the physician will usually not order a cephalosporin because of the danger of this crossover allergy. You want to avoid alcohol because these medications interact with alcohol and the patient may become flushed, they may get dizzy, they may have a headache, and they may experience muscle cramps. So again, cephalosporins, patients should not take alcohol while they're taking it. And again, with this antibiotic and most of the other ones, the physician will order a CNS, a culture and sensitivity, before the first dose is given. And the reason this is used is they want to make sure that the medication that is prescribed is effective against the disease or the bacteria that the patient has, because if it's not, it's not going to be effective. But again, the biggest thing with the cephalosporins is because of the similar molecular formula with the penicillins, they should not be used for patients with penicillin allergies. And one of the last things with cephalosporins is they can cause false positives for proteinuria, or protein in the urine, and glycosuria, or glucose in the urine. Let's talk about the fluoroquinolones. Examples of this medication are Cipro. These medications act by interfering with DNA replication in gram-negative bacteria, and they are used for problems such as E. coli, Pseudomonas, and Staph aureus. Let's talk about the side effects you will see with the fluoroquinolones. Side effects are diarrhea. Again, we talked about the fact it decreases normal flora. There may be a decreased white blood cell count and hematocrit because they interfere with blood formation. They may have elevated liver enzymes, and the ones we're talking about are the AST and the ALT, and they may cause an elevation in the alkaline phosphatase. What you will do for patients receiving these medications, again, we talked about the CNS, the culture and sensitivity, before the patient started on the therapy to make sure that the drugs are effective. With these medications, again, because they can cause some problem with the kidneys, you'll want to encourage fluids. Again, remember, normal intake is 1,500 to 2,000. We'll want to encourage fluid to about 3,000. These medications should be taken 1 hour AC, or before meals, or 2 hours PC. And the reason you want to avoid mealtime with these medications is food slows their absorption. So that would become a problem, and you want the best absorption you can for the patients. Other things you want to do is these medications should not be given with antacids or iron preparations, because that will interfere with the absorption. With this medication or the fluoroquinolones such as Cipro, sometimes the physician will also order probenecid. You probably remember that as a medication used for gout. But they find when it is given with some antibiotics, it increases the action of the med. So a little bit less med will go a little bit farther, and that may be used with this medication. Let's talk about the next family of antibiotics, and that's the macrolide antibiotics. These are medications such as erythromycin, clindamycin. What happens in this case is these medications, or this antibiotic family, binds to the cell membrane and actually changes the protein functions, so the bacteria doesn't function or act like it should. These are used for acute infections. They're also sometimes used for acne, They're used for upper respiratory tract infections, and many times these type of medications are used for patients, especially that have heart valve problems, before dental procedures, especially if the patient is allergic to penicillin. Let's talk about the side effects you'll see. The side effect for the macrolide antibiotics are diarrhea. They can cause confusion. They are hepatotoxic. Again, we'll want to check the liver enzymes to make sure they're okay. And they can cause superinfections. The nursing considerations for the macrolide antibiotics are these medications should be taken 1 hour AC or before meals, or 2 to 3 hours PC. And they're usually taken with a full glass of water, not fruit juice. Again, you want to monitor liver function because they can cause liver damage. And if they find that the liver function tests begin to show that there's a problem with the liver, if you discontinue the drug, the damage many times is reversible and it will get better. These medications, your macrolide antibiotics, many times will work with or increase the effectiveness of some other medications, and some of the medication it increases the effectiveness is Coumadin, remember, which is given to prevent blood clotting, and theophylline, which is a bronchodilator. So whenever your patients are taking medications, you need to make sure if the two, do they work together and increase the effectiveness of the other? Do they prevent absorption, or what effect does one have on the other? Let's talk about probably the most common and familiar category of antibiotics, and those are the penicillins. Amoxicillin, ampicillin, and augmentin are all penicillins. And the penicillins act by inhibiting the synthesis of the cell wall. These medications are not used just every time someone gets a cold. They are used for moderate to severe infections. They're used for syphilis, they're used for gynecological infections, and they're very effective against Lyme's disease. Let's take a look at the side effects you'll see. Stomatitis, or the inflammation of the mouth, is something that you will see with the penicillin medications. Again, it alters the normal flora and you end up with inflammation. It can cause diarrhea. There are frequently allergic reactions. Many patients are allergic to penicillin, and we talked about the hypersensitivity issue before. And there can be renal and hepatic changes. Again, remember, most medications are detoxified or metabolized by the liver and then excreted by the kidneys. And that is also true of penicillin, and it can cause damage as it is doing that. So one of the biggest things you'll want to do is you want to check for hypersensitivity. And again, remember, just because someone says that they're not allergic to penicillin, and have you had it before? Absolutely, hundreds of times. It doesn't mean that an allergic reaction cannot happen at any time, because your allergies can turn on. They usually don't turn off, but they can turn on at any time. And something that you were not allergic to before, you could become allergic to. Again, remember, it's not when you get the medication the first time. It's either the second time or any subsequent time you get the medication. Between the first or the last time and this time, the body has made antibodies against this particular medication or substance. With the penicillins, you want to give them 1 or 2 hours before meals, or 2 to 3 hours after meals. And again, remember, if someone says, well, I don't have a problem with penicillin, but I am sensitive to the cephalosporins, I have an allergy there. Again, remember, about 10% of the population there is a cross allergy, so they should be used, if at all, very, very carefully. Again, you want to check, because of the hepatic damages and the renal damages, you want to monitor the patient's output, you want to monitor the BUN, and you want to monitor the liver enzymes such as ALT and AST. Okay, we're still on the antibiotics. The next family are the sulfonamides. These are Gantracin, Bactrim, Spectra, and Azelfidine. These medications act by antagonizing essential components of folic acid synthesis in the bacteria. And again, you can see as we've gone through these, many of the antibiotics act different ways, which is why sometimes the physician will order more than one antibiotic. Now, your sulfonamides are used for ulcerative colitis, they're used for Crohn's disease, otitis media, and urinary tract infections. The type of signs and symptoms, the types of side effects you will see, it may cause peripheral neuropathy. It may cause crystalluria. These are crystals in the urine. The patient may become photosensitive, and that's sensitivity to light. They may have GI upset, and again, they may have the stomatitis or the inflammation of the mouth. Now, nursing considerations for the sulfonamides, you take these medications with meals or foods. And that's kind of different than we talked about with some of the other medications. Remember, penicillins you take before or after and many of the others, but the sulfonamides, because of the GI upset, should be taken with food. Because of the crystalluria, you want to encourage fluids. And again, normal intake, you need to do better than that, and you want to encourage fluids to about 3,000 per day. You want to give good mouth care because of the stomatitis that can occur. What you'll do is you give these patients or give these medications with a full glass of water. Again, you want to check renal function, again, one of the things you want to do, such as the creatinine. And again, antacids will interfere with the absorption of these medications. The next medications we're going to talk about are the tetracyclines. Some examples of the tetracyclines are vibromycin and panmycin. These medications inhibit protein synthesis in the bacteria, and they are used for things such as infections, acne, and they are used for prophylaxis with the ophthalmia neonatorum. Again, remember, these type of tetracycline eye drops can be used with the neonate right after delivery. Let's talk about the side effects you will see with the tetracyclines. One of the big ones is it may discolor primary teeth if the mother takes it while she is pregnant, or if the child takes it when the child is very, very young. It can cause also glossitis, that is inflammation of the tongue. The patient may experience a rash, and they may have phototoxic reactions. Again, remember, your phototoxic reactions are, you get kind of a sunburn reaction. So again, patients taking tetracycline should use sunblock 100% of the time when they're outside. Nursing considerations for the tetracyclines, you want to take these 1 hour AC or before meals, or 2 or 3 hours PC, which is after meals. You do not take the tetracyclines with antacids. You do not take them with milk or iron. You want to space them. If the patient is taking antacids and iron medications, you want to separate the two medications by about 3 hours. You want to note the expiration date on the medication. Some patients will keep medications because they maybe didn't use exactly all of it when it was ordered, and in case they ever need it again, they'll save it. Well, in the case of tetracycline, if the medication has been expired, it becomes a highly toxic substance, and you want to make sure and not have your patients save it. Make sure they know to throw that away because it can become dangerous. You want to monitor renal function, again, because it can be nephrotoxic, and you want to protect it from sunlight because the drug can break down or decompose if it is exposed to sunlight. Again, you don't give it with milk because that interferes with absorption, as does the antacids and the iron.